I.O.T, powering the digital economy. Brought to you by Schneider Electric.
Keeping fit and staying healthy is a priority for many of us. But when our health suffers, hopefully the health sector is on hand to support us. Bringing healthcare innovation to the public isn't straightforward, and regulation in this sector is some of the most complex in the business world. That's not stopping the biggest healthcare providers from developing solutions and bringing them to the marketplace. But how effective is this innovation in lowering costs, but more importantly, improving our health overall? To find out, I'll be visiting the university that's building a brand new hospital with 21st century technology at its heart. I'll also be speaking to the entrepreneur who's bringing doctors' appointments to smartphones.
Hey, my stomach.
And we'll find out what challenges healthcare businesses have to overcome to stay profitable. Healthcare in the United States is undergoing plenty of political changes. The most recent and biggest was the Patient Protection and Affordable Care Act. By 2016, over 20 million people had signed up for medical insurance. That increase could put a huge amount of pressure on healthcare systems right across the states. That's something that the oldest teaching hospital in the US is all too aware of. The University of Pennsylvania is embarking on a $1.5 billion investment in a new hospital, driven by new technology infrastructure. This hospital has been here for nearly 150 years, and the hope is that this new building will not only provide 21st century care, but will also be future-proofed. In the fast-changing world we live in, that's a tall order. The new hospital is going to be built on this site, and it's hoped that it will be fully operational by 2021. The Executive Vice President and Chief Administrative Officer for the University of Pennsylvania Health System is Kevin Mahoney. He's also a co-director of the Penn Medicine Center for Healthcare Innovation, which means that he has an eye on the future. But is that future already here?
We're at a point in time right now where it's extraordinary, the changes that are occurring, both at the advanced end of medicine. So we just recently had an FDA approval for a cell therapy that is curing pediatric leukemia, down to how we interact with each other using our smartphones.
So you're building a new hospital now. What's the reasoning behind that? Is it to satisfy demand, or is it to make the service that you're offering much more efficient?
A lot of people say to me, why are you building a new hospital when everyone keeps predicting we won't need hospitals? But I prefer to think of our buildings as platforms for improving the care that we deliver to our patients. Historically, hospitals have been organized around departments. So you had a department of cardiology, you had a department of open heart surgery, you had a radiology department, and we're trying to blur those. So there's no ownership of a department, and the only ownership rests with the patient. How do we make that patient better as fast as we can, as effective as we can? And we know we can do that by blurring the department lines and having people work side by side.
And how about the innovation? What's it going to be, and how will that impact the patients actually visiting on a typical patient visit?
So I think we did a couple things to innovate. From the employee perspective, we built a 30,000 square foot mock-up out of styrofoam, life-size mock-up, and we took over 600 employees through to tell us what do you like and not like. And we put GoPro cameras throughout the site, and we had people walk through, and then we analyzed those 100 hours. And the architects and the designers were able to pick up things that you may not have seen when you're just going through a facility, but when you looked at the video over and over again, you would notice the way you're going around the corner, the way you're interacting as you enter the room with the patient and things like that. So one was, how does the staff innovate around how the staff and their experience? The patient experience, I have pushed really hard that the root word for hospitality is hospital. And everyone says, let's go look at other hospitals. I said, let's go look at other hotels. How can we make this an experience for the patient that is not institutional. Part of that innovation is within each room, we have a giant media wall. And that media wall will have Skype or whatever technology we use. So the digital wall will also help with education, so that when the patient is talking to the physician and the residents and the trainees are there, they can all be in there using the x-rays, bringing them up on the digital wall, so the patient's involved directly in their care.
While the physical construction takes place, the various health contractors are testing out the technologies that will eventually populate the building.
So this lab, what we've done is set this up for three basic purposes: testing, then proving, and finally installing. So what you see on these, a lot of these walls, is we are testing out different products, different vendors, for very specific things that are going to be taking place within the patient room. So for instance, right here, we have some things that are involved with noise.
What is that?
So this constantly checks the noise levels in the patient room. Right, so you can see the number, right, so you can obviously see that. And the ear, that particular ear for this one, will be outside in the hallway. And so folks in the hallway would know that they are being too loud for the patient in the room. So that's one of them. I mean, there's lots of different things. We are testing out different lights and lighting controls within the space. And then the really big thing here is that how does all this stuff sort of work together for the patient and also for the staff, to make it as easy as possible. So we have a lot of patients and project that we will have a lot of patients who aren't that familiar necessarily with technology. So we want to also be able to have technology that works for somebody who's very tech savvy, but for also folks who are very novice with a touchpad.
What UPHS is doing is a leap forward in future proofing, and how they're adapting to digital innovation is remarkable. But where there's a business opportunity, disruptor companies aren't far away. One of them is Babylon Health, who've been around since 2013.
Dr. Howard from Babylon, thank you for booking a consultation with us today.
They're a digital healthcare provider offering consultations with a doctor or other healthcare professional via an app. Ali Parsa is the founder of Babylon Health. He's an entrepreneur who has worked in construction and investment banking. I want to know what technology he's building into his Babylon app.
Artificial intelligence is a science, right? So we figured out how to, for instance, let me take one piece of it. How does a machine diagnose? So we figured out how we can get computers to diagnose. It just happens to be that diagnosis is fundamentally probabilistic graphical modeling. So if you think about it, the doctor asks you a lot of questions, but they're constantly thinking, so what could it probably be wrong in here, right? So there's zooming down to a disease or two or three to provide you with what we call differential diagnosis, right? Machines just happen to be incredibly good at that when it comes to looking at billions of variations of symptoms and saying that what is the probability of the outcome out of all of those. What a machine cannot do is put its hand on your shoulder and say, look, I look after you after that. So we just allow the machines to do the bit they can do very well, but humans to do their bit.
And so the limitations is really that human interaction. So how do you make sure you get that balance right between providing and making the most of the innovations, but also keeping that human touch?
Well, it's almost a self-selecting process, right? So I call in, I say my tummy hurts, I might end up having gas, right? That's easy. The machine can reassure me. The artificial intelligence can reassure me and say that doesn't need to see a doctor. Then it's up to me to choose that, do I trust that or do I want to talk to a doctor to reconfirm? And hopefully after the third or fourth time that I call a doctor and it says exactly what the diagnosis of the artificial intelligence says, I say, okay, that's fine.
For those technical fans out there, I know they're probably dying to know, what platforms does Babylon run on?
So we are on your mobile, be it on your Android or on your iOS devices, but we are also, as of recently, on our website. You can enter our chatbot and have a consultation, either with our AI or, if necessary, with one of our doctors.
And obviously, mobile technology for the cross generations, in particular the millennials, the take-up is huge. Do you think you'll see a bigger take-up from the other consumers, the over 50s, where healthcare is incredibly important to them as it is for everybody else? Do you see a better uptake because of the variety of platforms that you're operating on?
It's not so much about age. is more about your emotional connection with adapting technology early. It just happens that younger people are more flexible in what they are prepared to test sometimes.
Now, strategically, where do you see this all going? Who do you want to work in partnership with?
So we, in the last 3 months since November, the National Health Service in Britain has made it available to people in central London. So you can actually now choose Babylon as your GP. You switch from your existing GP to Babylon. And what we saw is thousands of people joining in what we never expected. So we already have signed 3.5% of all young people in central London now. Having done that, we then went to one of the financially most challenged countries in the world, to Rwanda, and say, can we deliver this quality of healthcare at the prices that one of the financially poorest countries in the world can afford? And we signed up in almost no time, 18%, 17% of the adult population of Rwanda registered on Babylon. We deliver hundreds of thousands of consultations, and I'm delighted that Melinda and Bill Gates Foundation have just announced that they will pay for the entire nation of Rwanda to receive their primary care on Babylon if they choose to, in partnership with the government of Rwanda. And that's a testimony that in healthcare, you could do what we've done in information. You could completely democratize it. You could make it available to everyone, irrespective of their financial capability. And while that seems like, wow, how can that happen? But you and I forget that only 20 years ago, it was exactly this with information. You only had access to information if you were rich. You remember the adage, power, information is power? Now we all have access to all the information almost in the world as long as we have access to the internet. Google has solved that problem for us. I think we can solve a similar problem in healthcare in years to come.
Ali Parsa is taking advantage of the latest developments in IoT devices. It's that innovation which is allowing his business to thrive. The innovation isn't just in these devices, but in the apps and the data that businesses store. And those businesses need to be vigilant about protecting that data. But with regulations varying across the globe, it's a minefield. And I'm going to find out how companies navigate the rules after the break. Companies are pushing technology to the limits to provide more efficient ways of keeping us healthy. To do that, consumers need to provide more and more information about themselves. Increasingly, companies are using analytics, data analysis to diagnose health problems, but there are strict rules coming to force regarding the storage of personal data. The General Data Protection Regulations rewrite the rules regarding the data that all companies can hold about individuals. It has big implications for the health sector globally.
I think the impact it will have is giving consumers far greater control over the data that they share with businesses, the level of the granularity of the data that they share, and what those businesses can actually do with it once they've got it. So it will restrict a lot of businesses who effectively were taking data and using it for their own purposes. They'll find that a lot more difficult.
And will it be enforceable, do you think? Will it have real teeth?
Yeah, I think it will. And I think in a lot of sectors, people are running scared about what it might mean for them. And there's been a lot of last-minute action to try and make sure that organisations are compliant because they're worried about the impact if they're not.
Dr. Bill Hansen is the Chief Medical Information Officer at UPHS in Philadelphia. He's written about how digital is changing the way we get healthcare, particularly regarding telemedicine.
There are a variety of legal constructs that govern telemedicine. So in some states, if you are licensed in the state of Pennsylvania, for example, you are licensed to care for patients who are located in the state of Pennsylvania at the time you interact with them. If that same patient drives across a bridge to New Jersey and you wish to provide care, you have to then have a license to practice medicine in the state of New Jersey. Our telemedical physicians are typically licensed in all of the states in which they practice physically or virtually. In other parts of the country, it's in the interest of those underserved parts of the country to free up those licensure constraints. So one state might allow their neighboring states' physicians to operate in the first state in order to provide better care to underserved populations. So it's a complex mix of rapidly evolving licensure, malpractice, and credentialing rules and regulations.
So there's a complex mix. Do you think that will change, though? So there's just a general federal law that covers telemedicine.
There's a concern on the part of the insurance industry, for example, that by liberalizing access to telemedicine, that will lead to an increase in the use of medicine in general. So they're concerned about it. Patients find telemedicine to be a very convenient, oftentimes high-quality way to engage in getting care for certain conditions. So patients want it. Patients talk to their legislators who support liberalizing access to telemedicine in state and federal government. So I think we will see a change in the industry, but that's being pushed by technology's rapid advances.
And it's the regulation around telemedicine that Ali Parsa finds challenging.
So we had a situation again with a regulator where they just wouldn't agree to regulate digital health exactly as they would regulate physical health, right? Okay, it's the same. To you and I, we don't think digital money versus physical going to a bank. We just want our bank to be safe, right?
We just want it to work.
And we want it to work, right? So it took us a year of discussions and debates, and then at the beginning of this year, that particular regulator announced that they're going to regulate the two industries, the digital or non-digital health, exactly the same way. There's no such thing as digital health. Everything is digital nowadays. Why would you ever, if you can talk to a doctor from the comfort of your bed when you're sick, go in a bus, spend half of your day, go sit in a doctor's surgery while you're feeling miserable? We're going to shift to a world where most of our healthcare is delivered digitally.
So it doesn't frighten you, the fact that regulation is different around the world, different languages? You see that as an opportunity?
Regulation is a necessity because there is a lot of people in any industry that would take their chances, right? So we think it's important that it's there, but we also think that sometimes it could be done a lot more intelligently than it's done. And some countries do it a lot more intelligently than they do it. But it's just a necessity that we have to deal with.
There's no question that things are changing dramatically in the health sector. Globally, not every model is the same, with insurance-based healthcare in the United States, a taxpayer-funded model in the UK, and elsewhere, everything in between. The task of making them all work efficiently lies at the door of the innovators. And after the break, I'll be finding out what the future holds for healthcare. Digital innovation is having a huge impact on how we live our lives. The world is changing because of the technology that can help improve our health. But how far will that change take us? And how can business help democratise that change?
All of us are hoping to make a contribution to one of the big problems of the society. In our case, if we can make healthcare accessible, affordable, put it in the hands of every human being on earth, if we can do with health what Google did with information, that's a phenomenal thing to have achieved.
And of all the innovations, artificial intelligence seems to be the one rising to the top for you and many other businesses. Are there any other technologies under the umbrella of Internet of Things that you've got your eye on that are going to play an important part, whether it's augmented reality, virtual reality, and everything else that goes under that umbrella?
Everything we know about intervention in medicine is being reinvented. Whether it is electrobiology or synthetic biology, whether it is laser manipulation or audiology intervention, whether it is organ reconstruction or DNA reengineering. We are reinventing the way we can intervene in your body in a way that we could never imagine before. I wish more of us try and solve more of the bigger problems than some of the little problems we sometimes engage with. And the reason we do is because the commercial returns on delivering more advertising often is just more clear than delivering better healthcare.
So when are you going to be disrupted?
Oh, I'm sure when it happens, I wouldn't have a clue that what is going to hit me. Like it's going to happen so fast and so brilliantly by someone else. But listen, it really doesn't matter to humanity if Babylon succeeds to do this or somebody else. To humanity, what matters is that the solution will be found and our life will become simpler, better, easier, more enjoyable as a result. And that's what we should be focusing on, not the personalities or the particular company.
That emphasis on the patient is also where Kevin Mahoney sees his focus.
We want to work hard to more quickly diagnose our patients so we can begin treatment. And more quickly diagnosing requires artificial intelligence. It's going to require using big data. It's going to require looking for those patterns that we don't quite see, but always funneling it back through the physician who's been trained how to interpret that data. So I'm not advocating that we're ever going to get to the point where the computer treats you, but the amount of information that doctors are being told on a daily basis about new treatments, new evidence that's out there, artificial intelligence is going to be required to help condense that down and bring it directly to the patient's room so the doctor can intervene as effectively as possible.
The next 10 years, how do you see this hospital looking then?
10 years from now, again, I think we will have deconstructed the basics of primary care, early surgery and things like that will all be pushed to the outpatient side. I can see a point in the future where chemotherapy is done as much in the home as it is at a central location. So I think the patients that'll be here 10 years from now are going to be the sick of the sick that need that advanced level of care that we're going to deliver in a very compassionate manner. But more than half our money comes from the outpatient side now. So reduce the number of times the patients have to physically come here and increase the number of times that we can connect on a much more easier basis, whether it's a smartphone or home video or things like that.
So that's incredibly efficient. So do you think the new technology will make the hospital and the cost of the patient lower and actually more efficient going forward?
So we have two influences going on in America at the same time. One, we are very compassionate people. We want to make sure that people get the very best care. So we're constantly developing new technologies that do that, but they're expensive. And that is conflicting with our desire to maintain our economic leadership, which requires us to get the cost of healthcare down. So I hope 10 years from now, we're not spending 20% of our gross domestic product on healthcare. I hope it's less, but I hope it's more effective and it's more efficient and that the patients are therefore better off.
So how much of an impact will this have on society as a whole?
It's a game changer. And it's a game changer on a lot of different levels. When I think back over my life, the emotion and some of the things that took place within a hospital and the impact it had on my family, positive and negative. My children were born, very positive. My mom passed away, pretty negative. If we can improve that experience, if we can reduce the number of times that has to happen, the impact is just, it's going to be phenomenal. And that old adage, if you have your health, you have everything. You know, when you were 15, you didn't think about it so much. My age, I start to think about it. And if we can continue to improve people's health so that they can do the things they want to do, spend time with their family, read, have a productive work life and things like that, that's what we need to focus on. So I think the impact will be phenomenal. I think it'll lead to new ethical questions, hence my game changer idea, that we're going to have to sit down and decide as a society what are the limits of how far we're going to push technology in terms of what it does to us as a race and us as individuals. And I think there will be a lot of ethical debates to come.
The future of innovation in healthcare is built on solid foundations. That innovation is driving down costs and improving our health. With that comes the long-term hope of staying healthier for longer. The innovators say that they can deliver on that hope. Let's hope they're right.
I.O.T. Powering the Digital Economy. Brought to you by Schneider Electric.